This is the community-based teaching project on tuberculosis by Amber Jones, Hannah Black, Maria Lopez Lorenzo, Nicole Snyder, and Rachel Chaves.
Okay, so first we're going to talk about what is tuberculosis. Tuberculosis is an infection acquired via the bacteria known as Mycobacterium tuberculosis. It is a disease that is transmitted via droplets that primarily affect the respiratory system, specifically the lungs. Even though this bacteria usually attacks the lungs, it could also affect your kidneys, spine, and brain. And then I have a picture, and it shows the active TB person may experience chronic cough with blood containing mucus. So that's one of the signs to look for if you're having a continuous cough. And it shows the infected lungs, and then it shows the tuberculosis, or for short TB, bacteria that's in the lungs.
Active tuberculosis involves live bacteria that multiply in the throat and lungs that the immune system cannot fight off. This bacteria is highly contagious. It is spread in the air through breathing, coughing, sneezing, and as simple as talking. These patients look very sick. They present with fever, they have some weight loss, and at times they become weak and are fatigued. In latent tuberculosis, bacteria live in the body without making the host sick. In other words, their immune system is strong enough to fight off the infection. This bacteria cannot be spread to others as it can in the active stage. In order to confirm latent tuberculosis, a person has to have a normal chest x-ray and sputum culture after a positive TB skin test or blood draw. If not treated adequately, this latent tuberculosis can turn into active tuberculosis. People with a strong immune system can be infected with the bacteria for a lifetime and never experience active TB due to their strong immune system. People with a weak immune system may not be able to stop the multiplication of the bacteria that leads to the TB disease.
Signs and symptoms of tuberculosis may include a long-term cough or hemoptysis, which is coughing up of blood, chest pain, a loss of appetite, chills, night sweats, fatigue, weight loss, dyspnea or shortness of breath, and fever. Treatment and management. If you have a latent TB infection, your healthcare provider may begin drug treatments. This is especially true for people with HIV/AIDS or other factors that increase the risk of active TB disease. Most latent TB infections are treated for 3 to 4 months. Active TB disease may be treated for 4, 6, or 9 months. Specialists in TB treatment will determine which drugs are best for you. You will have regular appointments to see if you're improving and to watch for any side effects. Tuberculosis treatment regimens include a 4-month medication regimen, is the high-dose daily rifapentine, moxifloxacin, isoniazid, pyrazinamide. 6 or 9 months, RIPE TB treatment regimens consist of rifampin, isoniazid, pyrazinamide, and ethambutol. The management of tuberculosis involves a combination of medications taken for a specific duration of time. The goal for this is to treat and cure the disease and prevent any more transmission to others, have direct observation of therapy, evaluate it for treatment response, and then make sure to wear your mask in public places.
Prevalence of tuberculosis in San Joaquin County. Although the average amount of tuberculosis cases in California has decreased, San Joaquin County has one of the highest amount of cases compared to the state's average. Data from a 2021 report showed non-U.S. born citizens were infected at a higher rate than U.S. born citizens, and the image to the right shows the San Joaquin County average from the California Department of Public Health Services.
So the next thing we're going to talk about is preventing tuberculosis or TB. Especially in San Joaquin County, the rates are super high, so it's very important to learn how to prevent TB. So some of the methods are vaccinations, testing. So it's good to always be tested, especially if you work in the medical field or you've been traveling and have any symptoms of TB. It's always good to get tested and to have early diagnosis of it so you can quarantine yourself and not spread it. Two of the medications are isoniazid and rifampicin. These are used together to prevent latent TB. It kills the sleeping TB germs before they actually make you sick. So this is kind of like a treatment once you have it. Individuals who are at increased risk of being exposed includes healthcare workers, international travelers, especially all the close contact that you have in airports. So it's good to kind of have good hand hygiene and to separate yourself from others in airports. And those who are immunocompromised. So those people such as people that have HIV, elderly, if you have any other diseases, like if you are sick or if you have cancer, and young children. These individuals should especially avoid close contact and practice good hygiene. If you do have any of these symptoms, again, always get tested and have an early diagnosis, and so you don't spread it on to others.
The San Joaquin County Public Health Services website includes resources for TB testing sites and vaccination sites, information on disease prevention, and a healthy diet and lifestyle. The California Department of Public Health provides information on treatment and testing centers in the state of California, and also includes a yearly report on TB cases and populations that are more at risk for TB infections.